Bismillahirrahmanirrahim. Assalamu alaikum. This is Humaira, CEO of Empoweri. A warm welcome to the 4th Women Entrepreneur Virtual Conference. We are delighted to have an event that promises to be inspiring, enlightening, and empowering. Our theme this time is Empowering SHEalth Together, which reflects our commitment to foster collaboration, innovation, and leadership among women in the health technology sector. Health technology, as you know, is a rapidly evolving field with immense potential to transform lives and improve healthcare outcomes. Today, we celebrate the remarkable contribution of the women entrepreneurs and leaders who drive this transformation. Women are at the forefront of health technology innovation, from pioneering new medical devices and digital health solutions to advocating for patient-centric care. This conference, She Sparks in Health Technology, is a platform dedicated to showcasing those women sharing their stories and exploring the opportunities and challenges they face. As we come together virtually, let us embrace the spirit of collaboration and support that empowers us all. Together, we can advance health technology, break the barriers, and create more inclusive and innovative future. Thank you, all of you, for being a part of this incredible journey. Let us make the most of this day, learn from each other, and continue to empower SHEalth together. Let me introduce our esteemed guest speakers. The first guest speaker of this conference is Dr. Bismil Jadoor. She is a consultant with extensive experience in gynae. Her global collaboration with the WHO and leadership in implementing healthcare initiatives showcase her impact on maternal health. With a master's degree in international health and clinical leadership, she excels as both a practitioner and a leader in her field. Expertise in managing menopausal health and proficiency in minimum invasive surgeries highlights her dedication to patient well-being treatment with precision. Welcome, Dr. Bismil, and thank you for taking out time for us for your busy routine.
Thank you, Humaira. It's been an absolute pleasure. Thank you for having me on your platform.
Our next esteemed guest speaker is Dr. Farah Issa. Dr. Farah Issa Zadi is a founder and CEO at Dr. Farah Issa Academy. She is also a director at Dr. Issa Laboratory and Diagnostic Center and dedicated physician and clinical educator of global experience in Canada, Saudi Arabia, and Pakistan. In the practicing and training of advanced and high-risk ultrasound, Dr. Farah Issa founded DFEA to bring about a paradigm shift in the quality of healthcare in Pakistan by providing quality education and developing skilled healthcare resources in the country and globally. Welcome, Dr. Farah Issa.
Thank you, Humaira. I'm really happy to be here.
Our next guest is Professor Dr. Jolia Azhar. She is a leading figure in oral pathology and medical education, excelling as a consultant laser dentist, cosmetologist, and aesthetic physician. Her groundbreaking work in laser dentistry and laser-assisted pain control clinics since 2005 has received recognition, including the prestigious First President Women Business Award in 2022. Welcome, Professor Dr. Jolia.
Thank you so much. Thank you, Humaira. Happy to be here in another one of your interviews.
Yeah, I'm honored. And our last but not least is Ms. Sana Khan. She is the CEO and founder of Her Health, founding president of Leader Club, and an active advocate of community building women's health empowerment. She leverages her expertise in leadership, PR, and branding to drive impactful initiatives. Sana has received multiple national awards and has been nominated for 2 international awards. Welcome, Sana.
Thank you so much, Humaira. While I try to figure out how my video works, thank you so much for the introduction.
I'm honored. Okay, let's start this formal session, and I would like each and every one of you to introduce yourselves so our participants will be knowing more about you. Let's start with Dr. Farah Isa. Yes, Dr. Farah Isa, tell me about yourself.
I've been a practicing radiologist for the past 25 years. I've been working in globally, starting my career from Canada and going to Saudi Arabia after, and now in Pakistan. And I am leading the radiology and administration at ESA Lab, as well as having my own academy. Apart from that, I'm also the president of Open Karachi, which is a global organization starting from Silicon Valley, which focuses on basically IT, tech, and many other areas, entrepreneurs from various fields to come together and join and get mentorship or connections for entrepreneurship. And and especially coming to Pakistan, I think I have been really focused in empowering women, and especially my goal is actually to empower women and transgenders to come into the healthcare profession. So, and actually to raise the bar in providing quality care and technical trainings to these people, so that they affect proper patient outcomes in Pakistan and eventually globally.
Amazing, amazing, Dr. Farah. Now we are moving towards Dr. Bismeen. Yes, Dr. Bismeen, tell me about yourself.
Yes, thank you, Humaira. So I think after the prestigious introduction, I don't know what to say, but just in very brief, I started my journey from Pakistan, which I'm very proud of. So after having my degree, I went abroad and sort of started my specialist training in obs and gynae. So I was trained in Oxford Deanery for about sort of 8 to 9 years. And then I worked as a consultant. Then I decided to do something different that had an impact at a much broader level, rather than a patient-to-patient or patient interaction. And I had this exciting opportunity in the WHO in the Eastern Mediterranean region, where I was working in policymaking, academic, and research on various projects towards maternal and child health. And we were optimizing the cesarean section rates, which is like an epidemic at the moment all over the world. I was there for 6 years. I really enjoyed my time, and then came back to UK, and now I'm working as a consultant obstetrician and gynecologist. My special interest is a minimal access surgery, and I'm a menopausal specialist in ambulatory gynae. And my sort of aim, especially after having that broader experience in other health systems, is to provide kind of an holistic approach to women health rather than dealing with single issue when they present to my clinics. And that has certainly changed my practice over the last few years. And I think in relation to your company logo, this is exactly what I'm working towards with my team, is to make sure we empower women to kind of take control of their health, to be a bit more responsible for their health, to come forward and seek help. And this is kind of a good start. And then, the healthcare facilities and practitioners come into practice then. So yes, this is just a brief introduction. Thank you.
Very nice, Dr. Bismeen. Now coming to us, Professor Dr. Jawriya Azhar. Yes, Dr. Jawriya Azhar.
Thank you so much for having me on this platform. It's really nice to sit with such esteemed women of knowledge, and it has a certain wow factor. My journey started basically as an oral pathologist, and so I was in diagnostic health sciences, but that actually led me to various other areas of interest. I did my oral pathology training from UK, and then afterwards I came back and joined Pakistan as an assistant professor. This was back in 2005. Later onwards, I went on to pursue oral pathology further, and that got me interested into regenerative medicine. Now, this regenerative medicine is very important as far as your topic of today is concerned, which is the health tech, because the health technology is seeing leaps and bounds, in the field of regenerative medicine. So then I went to Germany to pursue my fellowship in lasers. And I came back to Pakistan again, joined my academic activities. I've been to Saudi as well. I was a professor there in the Princess Noor University. It's one of the largest all-women universities in the world. I stayed there for around 4 to 5 years, and then, COVID stuck. So I came back to Pakistan. And then I had started my practice in the year 2011 and 12. So I then started pursuing it. But apart from that, I have got other interests as well. Like, for example, I'm the president of the Pakistan Society of Oral and Maxillofacial Pathology Federal Council. I'm also the founding president of Pakistan Association of Women Dentists. I'm the counselor for Pakistan in the International Society of Laser Dentistry. And then, the health sciences, health tech, it goes hand in hand with the business community. So I'm an executive member of the Islamabad Women Chamber of Commerce and Industry. And I'm in the Islamabad Chamber of Commerce, the ICCI. I'm the convener for this subcommittee of health and prevention. So all these things, they sort of work together.
Mashallah, mashallah. All of you are having a great contribution. Now coming towards our last but not the least, Sana. Yes, Sana, please introduce yourself.
I think she's signed out.
Sana, are you there? Okay. We will just move towards our moderate discussion. The question I want to ask from Dr. Farah. Dr. Farah, mashallah, I have seen that your career and profile throughout your journey, in which you have contributed a lot in the health technology as well as in the women empowerment. I just want to ask from you that what inspired you to enter the health technology industry, and what are the challenges that you faced as a women entrepreneur? Mic on kar de, Dr. Farah. Mic is mute.
Thank you, Mera, for asking this question. When I look back on my journey, it has. I think I'm at a point in my life which I think I'm making the most impact. During the time that I was training in Toronto and working in Saudi Arabia, in the best of the places, I think the most impact I've made so far. Has been in Pakistan, and I think that's what inspires me. Number one, I think making people have skills which can provide them an economic empowerment as well, especially women. And apart from that, raising the health standards of healthcare, in Pakistan, which I think was the most challenging thing that I went through. When I came to Pakistan, I saw such a big gap between my education, my training, and training in Pakistan of doctors and also of technicians as well. So my aim became, to improve their education and their skills to come at par of world standards. In fact, North American standards, so that ultimately the patient outcomes would increase in Pakistan, which are actually terribly low in many parts, especially in the villages, in those out of reach places, and many times in the slums, clinics in the slums in Pakistan. So I've been focused on that, and I think that's what inspires me every day. And the other thing is my work on transgenders, that I'm trying to raise awareness and make them employable, and providing them and making them come into the healthcare sector, so that they can serve their own community as well as be a part of the society at large. So these things, I think, inspire me the most, and I think they are not only gratifying, but But when you even take a woman who has been a doctor, who has trained, done her MBBS and sitting at home, you try to get them out, start working, it's actually utilizing their skills, and actually acts as empowering them and empowering their entire households. So I think that's been by far the most gratifying experience in these 25 years. Apart from the other question that you asked, so you said about the health challenges, the initial challenges that I faced. I think the biggest challenge I faced throughout the world globally, and it's not just in Pakistan, it's the gender bias. When they see the women and women excelling, and as women, we try to juggle many things at one time, and it's and we try to work hard always, harder I think than our men counterparts. So I think the gender bias is one of the most you fight with it in North America, in Saudi Arabia, and back in Pakistan. So I haven't felt any different in Pakistan or in Canada, because you have to ultimately keep on proving yourself, and there are glass ceilings and barriers. I think that's, and the other thing is, of course, the work-life balance. Trying to give your family the best and your work the best. I think that's by far the most challenging thing. Thank you.
Very true, Dr. Farah. I mean, keeping in mind your point of view about the glass ceiling. If Sana is here, Sana, can you hear me? Sana, can you hear me? Because I want to ask from Sana the same question. And she is not here. Okay. Dr. Wesley, just tell me about that health technical innovations that you have addressed, that has addressed the disparities in the healthcare access, and what are the possible outcomes of the women in Pakistan through your experience?
Okay, I think it's a very good question and a very pertinent question. As Dr. Farah has also mentioned about some of the disparities that happen based on gender. I mean, I've not worked in Pakistan for much. I was really in the start of my career, but obviously I'm in touch with lots of my colleagues and had lots of discussion with them. So I'll start off, what actually disparity mean, and what are the factors that leads to those disparities, and how innovation can help them. So the disparity means that so two people are not getting the same thing, and especially when we talk about healthcare, right? So the universal health coverage, which is the Millennium Developmental Goal from the WHO, means that every person have a right and every person should access the quality healthcare, and that is certainly not happening around the world. And there are a number of reasons for this disparity. As one of them is, Dr. Farah mentioned, is the gender. The woman, she's absolutely right. Whether you look at the African countries, whether you look at the modern world, we have seen that this disparity certainly exists because of the gender. And then comes the socioeconomic factor, which is the biggest factor around the world. And because of that, a lot of women are unable to come out of their home to seek help. They actually don't know that the healthcare facilities exist. So the socioeconomic factor is the big one. And then we need to see what and it's not just getting to the healthcare facility. So I'm not just talking about the transport, I'm not just talking about someone taking them to the healthcare facilities, but there are different levels of getting access to the healthcare facility. So if we start from a very first level, which would be their inability to perceive, which means that people actually don't know that these facilities exist. They are absolutely naive about it. So the innovation on health technology, for example, through the social media, and the information, for example, these webinars, for example, these conferences, dissemination of knowledge through virtual media, through social media, through print media, electronic media is something that we can use to spread the information, to spread the education, to kind of address that level of their inability to access. So that's one thing, the information and education. And then comes their inability to kind of seek. So once they know that there is the healthcare facility available, or the treatments are available, their inability to seek that. So what does that mean? That means that because of the cultural implications, because of the cultural restrictions, they are unable to come out of the houses. People are unable to access that. And how the innovation will address that cultural issue. So this comes from, again, with the virtual consultations, because if we talk about Pakistan, and because of the conservative society, and I'm talking about the sort of low socioeconomic group, I'm talking about the conservative sort of families where they don't allow women to come out of their houses, the virtual consultations have done a remarkable innovation, to be honest. And we have seen that in COVID as well, and it saves life. I'll just give you one of a very good example. So my brother-in-law, who's a neurosurgeon, so he was telling me the other day that, what's happening in Gaza, it's really a hell, over there for women, for children, for men, for everybody. And everyone wants to go who have a sympathy for them, but obviously it's difficult. So what he was trying to do is, he was conducting virtual consultation with the doctors there, and this actually is saving life over there. So you can see how innovation, how advancement in the health technology is helping towards saving human life. And then obviously the last sort of inability is inability to actually reach, inability to for example, when I was working in the WHO, and I was working in the Eastern Mediterranean region that covers 22 countries, and mostly were African countries, Middle Eastern countries, and some of the Asian countries. And we were working on this project, which was about optimization of cesarean section. So when we kind of explored this project, it was very interesting to know that we have countries, for example, Lebanon, Egypt, Turkey, which has one of the highest cesarean section rates in the world. And then we had African countries, for example, Somalia, for example, Sudan, which has a cesarean section rates of less than 5%. So we do know that women who need cesarean section should have one in order to save the life of the mother and the baby. So you can see the contrasting difference. And when we explored it further, one of the things that we looked at this disparity was that they live in such far-off areas that they were unable to reach the healthcare facilities. And they were so frightened by this word, i.e. cesarean section, because section in their language means to cut open, to just kind of, and not being able to stitch back. And they were so frightened with this word. So this is again a cultural thing, that they decided to not have it, as a result of which the baby died at home, mom died at home, just because they couldn't have that treatment. So we at the WHO level, we changed that word from cesarean section to say it's cesarean birth, to kind of customize it, as you can say, with the culture. So these are very little things, that we need to change in our settings, in our healthcare settings, to sort of make sure that we address all those disparities and make sure that everyone has access to healthcare facility, irrespective of gender, race, color, and socioeconomic factors. Thank you.
Very true, Dr. Bisween. Keeping in mind the same, thought of Dr. Farah and Dr. Bisween, I just need to ask from the Professor Dr. Joria that the challenges and that all this experience, innovation and technologies, those Dr. Bisween and Dr. Farah has mentioned, So what are some of the most significant advancements in health technology that your business, Tohether, has driven in recent years? Can you highlight on that?
Yes, these are some very pertinent points that were discussed by actually Dr. Bismeen and then Dr. Farah as well. I was actually thinking of the examples that I can quote of the points that Dr. Bismeen was just raising. Like, for example, she said equal health opportunities for everyone, and then, innovations. In a country like Pakistan, bringing in an innovation is an extremely difficult task as well, because the general public acceptability is the biggest hindrance in this. Not only the general public, but sometimes, it's even in the healthcare sector, the people are a bit naive, and the recent advancement in the healthcare sector ends up facing problems not only from the general public but also from the doctors community in the Pakistan. And this I've been seeing since 2005, when we introduced salivary diagnostic kits here. They had the same sensitivity and specificity as the tests from serum being done, but whenever we would issue a report, the consultant physician would reject it, and the patients would bring the report back that it has to be done on the serum. They did not have the awareness at that time that this is an innovation, but the sensitivity and specificity is actually the same. Same happened with the laser healthcare setup. Initially, when it was launched in 2012, it was a huge innovation. In 2012, people didn't know much about photobiomodulation therapy and regenerative medicine. And when we said laser is treating pain, it actually faced a huge wall. I mean, people were very skeptical of it. So it took a longer period of time in getting that accepted. When I compare that to Saudi Arabia or Gulf, where I introduced the same things, I mean, over there, people were more receptive, especially the healthcare community was more receptive of these innovations. In Pakistan, it took around 8 to 10 years in since as far as 2005. But some of these projects, like I gave you an example of the salivary diagnostics, they faced total, I wouldn't call them failures, but they certainly did not have the attention that they actually deserved. Totally non-invasive diagnostic techniques were not a thing for Pakistan. I had realized at that time. Maybe if we relaunch it, then it would be another story. Similarly, and I was also mentioning the points that Dr. Bismeen had mentioned, that regarding regenerative medicine and laser, I would say that laser regenerative procedures are certainly, I consider them to be the most significant contribution that I made in this field, because we established these centers back in 2012. However, people were a little skeptical about it, even healthcare workers. And what I realized at that time that, information to the masses is as important as introducing a new technology in the field of healthcare. So therefore, working on these terms, I then opened up my academy, which is called as the Pathodont Academy of Continued Professional Development. At that time, this was in 2013, we had very few academies who were offering, and just one or two who were offering international fellowships and courses. So we then started offering the German fellowships over here. And again, there's a lukewarm response at that time from the healthcare, sector. But anyways, we continued. And as far as the recent technological advancements are concerned, now this is the era of the artificial intelligence and digitalization. So in our setup, all things are completely digitalized, and we have our partners like Instacare. They would be listening or they would be listening to the recording as well, who provide us with the digital platforms with which to carry out these different services. Being totally digital actually helped me a lot, because when COVID stuck, we were in a position to immediately launch the online clinics, and that was only because the digital setup was already in place. So we were actually the first ones to immediately start online clinics from the the platform of Instacare and Pathodont Polyclinics, and those digital clinics then continued working for over a period of 2.5 years until COVID ended back in 2022. So it was really nice, and now we are venturing into artificial intelligence. As you know, that artificial intelligence has got huge potential, especially in the field of diagnostic sciences. and facial scannings and intraoral scanning. So we have now intraoral scanners here, and using AI to tell us what is the probability of a person actually developing certain things. But again, over here, I'd like to mention that in the Pakistani culture, our local culture is not more about prevention, it's more about treatment. However, the rest of the world is actually moving towards prevention. It's preventive medicine. You need to predict different things. There are probability scenarios. All the tests are also, they guide us towards the probability of developing and things so that we can intervene before this. So this is a huge problem in the aesthetic industry. When we go abroad, it's more of preventive, like skin boosters are more in rage, polynucleotide injections are more in rage. But in Pakistan, the more famous treatments are still Botox and fillers and the treatment things. Anyways, but along with like I said, we need to reach out to the masses and continue carrying out such informative webinars and on social media for laymen so that they get introduced to the latest health innovations.
Thank you so much, Dr. Humaira. Keeping in mind your, things about creating the awareness of this health technology, I want Sana, welcome to this conference, and just brief about yourself a little bit and highlight on that your initiative, especially regarding this health technology that you have done so far.
Hi, thank you so much. So first of all, thank you, Humaira, for the introduction in the beginning of this very, very interactive gathering that we have, and I feel very honored to, be part of the panel where a lot of very, very experienced and knowledgeable ladies are sitting here. So congratulations on getting all of them together, and thank you for including me in this panel as well. So just like you mentioned, my name is Sana Khan. I'm CEO and founder for SHEalth. SHEalth is a very I just started this in 2024. It's a baby startup right now. I'm not even pitching it anywhere, but there's a whole context and the story as to what SHEalth is and why did I think about initiating in Pakistan as well, because I've been listening to what all these very, very professional, knowledgeable ladies had to share, and certainly healthcare and preventive medicine, health tech especially, and preventive medicine are some things that Pakistan probably is lagging behind, as well as the role of technology or ML or AI in the diagnostics and even otherwise in primary patient care. So from my experience, I have been working in trainings and public sector, public dealing, communication for about 10 years now. I started working when I was still a student in 2014, and it's been exactly 10 years this year that I've been working. I've had chance to travel around the world. I've studied for 2 years in the US. Then I came back, and I've always been in professions and in work capacities where I had to deal with a lot of students and trainers and professionals alike. So, and myself, I have been suffering from PCOS for 6 years, and coming from a family where half of the people are already doctors, it was still very, very hard for me to navigate through this journey, especially living in Pakistan, where one of the taboos, with the biggest taboos, was around the reproductive or gynec health for females, that if you're unmarried, you cannot go to the gynec's office because although you're a woman and other women who are sitting there in the waiting area, they would be stigmatizing you as to why did you feel the need to visit. So I think that was one of the biggest reasons that my mother never shared it with any doctor, couldn't think for the longest time to take me to the gynec's office. And that's how the problem was there, but it went undiagnosed and untreated. So when I got married and then I went to the gynec's, obviously after a year, just to cure the primary infertility issue, then I got to know that I was suffering from PCOS. And that's how, that was about the time when I joined Hospital, which is a health tech in Pakistan. And although they were replicating the model of Instacare and Marham and Oladoc, which is doctor-patient consultations, and they're providing a platform where both the stakeholders are getting together. But I thought that health tech has to go a step ahead in Pakistan, in preventive care especially. And for that, we need awareness, even in educated urban areas where people are working, especially women like me of my age who are working. They have access to the social media, they have access to the awareness, and they can stand up for something. They can join a cause if they really are aware about it. And especially one of the biggest barriers that we had to face in Pakistan was that we do not, as a nation, we do not believe in preventive care. We only believe in treatment. And we also believe that healthcare is something that we do not need to invest our time until and unless we have a problem and we have to go to the doctor. So the first part that we had to cover was create massive awareness for that. So I joined Hospital as COO, and then I was promoted as co-founder after 6 months. And we worked massively on PCOS, women reproductive health. And I had to resign from that position this year. I wanted to start working on writing a book. I had to I just wanted to write something from a layman perspective, that even if you haven't studied biology or science, but if you're well versed in Urdu or English, you need to, women, by you or we, I mean women. Women need to understand, girls need to understand that why menstrual hygiene, very appropriate knowledge about your reproductive health and how to take care of it. And because Minister of Health of Pakistan says that 52% of the reproductive age of women are suffering from PCOS. While in my last 2 years of constant surveys and researches throughout different universities and corporates and people who I actually know, I think the data that we have, I was just saying this on another TV program last week, that we have about 82% of women of reproductive age suffering from PCOS. And I'm sure the rest of them are probably on borderline, and they're not included in that percentage because they never went for a diagnosis. They didn't have a chance. And I'm just talking about the population of Lahore. You can see Lahore is one of the most advanced cities in Pakistan in terms of technology, in terms of opportunities and exposure, and people talking about a lot of causes, for example, breast cancer. So PCOS is still not so much talked about, but this is what her health and I myself am committed to create awareness and to talk about and then present solutions for PCOS-free Pakistan, and also the mental health problems, addressing them that come with PCOS.
Amazing, amazing, Sana. Amazing. Your contribution is remarkable. Keeping in mind your contributions towards this PCO treatments and awareness sessions, I just would like to ask from Dr. Bisween. Dr. Bisween, how you are going to take highlight on this PCOS issues? And in UK, what do you think? So how you are going to cope up with this issue? And what do you suggest in Pakistan here?
Yes, thank you, Humaira. I think it was really enlightening and eye-opener what Sana just said. And I think our experience is on one side, and Sana's inspiration is, I'll just say it's a very different level. So well done, Sana, with the work that you have done. It's something that you suffered. And thank you so much for sharing your story, because that's also not what everyone can do. And it was amazing to see that what inspired you to do something for others so that others won't suffer. So well done again. Yes, coming to your question, Humaira. So, I think I would agree with Sana. PCOS is one of the commonest gynae problem that a lot of women suffer, especially our young girls. But I would like to just clarify that there is a big difference between polycystic ovaries and polycystic ovarian syndrome. So these are two different entities, and it's quite common that people often mix them. So a lot of, for example, if I do an ultrasound scan on 100 women, maybe 40 or 50 of them will have ovaries that looks like polycystic, that have cysts in it. But that does not mean that they have polycystic ovarian syndrome. When we talk about syndrome, it's a whole different disease where a person will have all the symptoms, starting from menstrual irregularity to some other clinical features, for example, weight gain, hair growth all around their bodies. And then we talk about blood tests where they have deranged hormonal profiles. So these are the three kind of criteria on the basis of which we kind of say that this woman has polycystic ovarian syndrome, whereas other women who just have appearance of polycystic ovaries on the scan but don't have any symptoms. So there's a very big difference. I think to start off, it's very, very important that young girls, they seek help and educate themselves about the disease, because the sooner they know about the disease, the sooner they will work on their treatment. And the first treatment, before actually we start any medication, if I can give any message through this platform to those who suffer from polycystic ovarian syndrome, is to start working on your diet and exercise, because the first thing you do is to try and reduce your weight. Now, there will be some women like Sana who will be very smart and they don't have problem with their weight, but that's a very small kind of group of polycystic ovarian syndrome. But most women with polycystic ovarian syndrome, they have problem with weight gain, and I can assure them that sooner they will bring their BMI within the normal range, the quicker their menstrual cycle will become regular, their hormonal profile become regular. The underlying pathology is insulin resistance, and therefore the weight gain and the weight loss is very important with that. I don't go into the detail of the mechanism and how it works, the polycystic ovaries, but this is just a very quick thing. And then we come to the medication, and of course there are medication available, but I do tell girls who come to my clinic is, look, these medication will only work if you bring your BMI to the normal range. So what I would suggest, a very simple thing to all the girls, is that check your height, okay, check your weight, go online and calculate what should be your normal BMI. And if your BMI is not within the normal range, try and reduce weight. So this is the first thing. So yes, educating, seek help. And if you have underlying polycystic ovarian syndrome, you may be thinking of, if you're planning to have a baby, just start trying early and not leaving it for too long. So nowadays what's happening is, because we are career women, we tend to kind of delay our fertility for longer because we want to establish our career and stuff. But if you have an underlying issue, you may want to start trying early to see that if you encounter a problem, and if you encounter a problem, you may seek help earlier. The problem is after the age of 35, our fertility decline. And if you have an underlying issue, for example, polycystic ovaries, then your chances of getting pregnant will also go down. So another advice I give to younger women, for example, a 17-year-old or 18-year-old come to my clinic and diagnosed with polycystic ovarian syndrome, I do tell them that, look, I know you're not married and the baby is not in the picture, but this is something you have. So if you're planning to, if you want to have children, my advice would be to start trying early, get married and start trying early, because you may encounter problems. And the long-term implication, as I said, because the underlying mechanism in insulin resistance is the diabetes, is another disease that will happen with polycystic. Yes, so I think I'll just stop there, because this is a clinical thing and I can go on forever on that. So I'm sorry.
Thank you so much, Dr.
I would like to add a comment, Humaira, if you allow.
Yeah, please, Sana.
I think this was one of the most comprehensive executive summary that I've heard so far from a gynac about PCOS. And this is exactly what I'm talking about, because a lot of educated working girls, because I have a very wide network, alhamdulillah, so I keep talking about it, and a lot of women come to me for their young daughters or for themselves if they are in that age bracket, just as mine. I just turned 30 last year. And in response to your comment, Dr. Saiba, that I'm very slim and I don't probably look like a PCOS typical patient, like textbook one. I just lost 20 kgs after making dietary changes and from switching from a very sedentary lifestyle to an active lifestyle where I was doing a lot of resistance training and yoga and help with that, and dietary changes as well. So this all started when I thought that I should put my 18 years of biomedical education to use and think like a scientist, and maybe not only rely on metformin, because that alone would not help my condition or my symptoms, as I have to start taking care of what I'm eating and how I'm eating and how it's affecting my body, and other supplements. Then I found a lot of people on social media who were talking about PCOS, different opinions about the medication. One of the biggest challenges that I faced was very, very unkind gynacs in Pakistan who would not be very open to you asking questions. As a young girl, I was trying to understand what's my condition and what do I exactly need to do, how do I follow through with it, what do I need to eat, and I had a lot of questions, curious mind, unfortunately. And a lot of other girls and women I've met, they also have that. That's how I thought of starting writing a book where I could answer these baseline questions that Dr. Saiba has very comprehensively answered right now. What's the difference between the conditions? What do you have to do? But then along the way, when I was writing it, as somebody who comes with a biomedical background, yes, but not a doctor, and also a patient. So that gives you a very, very different perspective than from only a doctor. So while I was writing the book, I'm still writing it, by the way. I plan to publish it in September this year, inshallah, because September.
Yes, Sana. I think so. There is some technical problem. Okay, thank you so much for highlighting these critical issues. Yes, Sana, you're back.
Okay, so when I was along the way, I thought of inviting different professionals to write collaborative chapters on it. For example, if I invite a gynecologist, which I've reached out to many in Pakistan, but they just don't have the time to talk about something that would probably benefit a bigger, masses of women in Pakistan. So they just don't have the time. And that is one of the corroboration of my initial hypothesis, that they're unkind and they don't want to answer questions. They just want to shut you with the prescription and you should coming to them. So, but I've reached out to many who are working outside of Pakistan. I'm still focusing on people who are working as fitness experts, as mental health experts, as yoga fitness trainers, as aromatherapists, as dietitians, as internal medicine specialists, and a lot of people who have, because we're talking about a syndrome, so obviously it's going to come with a lot of different 12, 13 different branches of problems, just like diabetes. So my focus is to invite those, and I'm working with those people for them to give their perspective. For example, what does a fertility expert has to say for PCOS patients? What does a yoga therapist can tell to PCOS patient, and so on and so forth.
Very informative, Sana. You have highlighted all the issues that we actually need in Pakistan, and definitely we have all those challenges and the attitude of most of the doctors that is not coming up with that, and expectations of ours, what we are supposed to ask from them. I just want to ask from Professor Dr. Joharia, because you are also member of different, executive member of the chambers, plus convener of one of the Chamber of Commerce in health sector. So what do you think so that how can we create the awareness of all these problems that has been highlighted by Sana and Dr. Bismeen here? And what is the role of this networking play in the health technology? What do you think so?
Yeah, I had a lot of thoughts and comments coming into my mind, listening to their discussion and all that. One of the things that Sana rightfully highlighted was the lack of communication skills in our doctors. And I think this is also because being a medical educationist, I'm also looking at it critically. And this is because we are really paying very little attention to the development of soft skills in the doctors in medical colleges, like communication skills and interpersonal skills and communicating to the patient actually. And she's absolutely right. Like we already discussed, there's no emphasis on prevention, and then there is no emphasis on the pre-treatment and the post-treatment information that has to be given to the patient. Although in today's scenario, that is critical information. It is a critical part of the treatment. If you just do a little procedure or you just prescribe a little medicine, it's not going to work if there were no pre-instructions or no post-instructions to accompanying it. But that's not happening here, and certainly that is a topic for another day. The curricular changes that we actually need to bring about. Considering your question that you just said, obviously, I think the inclusion of technology as a subject and innovation, not only in the medical colleges as an important subject, getting credit hours and certain marks, it has to be incorporated. And then trying to, introduce this to the women and girls of Pakistan, I think it has to be made a core subject, like the technology, the latest technology has to be made a core subject, I think, in the schools and colleges of Pakistan as well, if we are to progress further. Having said that, we had identified this, and as a result of which we had actually launched a healthcare incubation center 2 years back, and in which Humaira, you were a part of that. And the sole purpose of it was to create awareness among the masses, and especially girls and women who are interested in the health tech, of how to do, networking. Like we are 3 or 4 people gathered together from very different backgrounds, but look how many points on which we have actually can sort of converge and draw something of importance for Pakistan out of it. So I would really like to invite Dr. Bismeen and Dr. Sana, and Dr. Farah has left to join our incubation center incentive as well. We plan to carry out such awareness campaigns for the population, because I think certainly awareness campaign for the population is very important. For the healthcare sector is also extremely important. 2 different domains, but we need to engage all the stakeholders, obviously at different levels of expertise and at different levels of engagement, but it has to be done. And the chambers are on board with our incubation centers. So were a few banks. We are also in the process of signing some new MOUs, and it would be really beneficial for all of us to collaborate in these areas.
Definitely. You rightly said, job, Dr. Jamia, because I've been also part of your incubation, and it's a really good initiative to create the awareness, especially in the field of health technology. So our session is actually, I don't want to end the session because such an informative, discussion from all of you, and I think so. I am definitely sure that all of the participants who will be watching now and maybe watching later, so they will be definitely gain a lot from your expertise. So we are moving towards the end of this session, and I want each and every one of you to come up with one piece of advice for the women entrepreneur, women leaders, women diversity. That what do you want to give the advice to them especially in the perspective of the health technology and innovation? Yes, I would like to start from Dr. Bismeen. Dr. Bismeen, can you please share your piece of advice with all of us?
Yes, Humaira. So just first of all, would like to thank you, Dr. Jadia, for the invite. Would definitely love to be a part of your incubation center. The name sounds just so fascinating. I've not heard that name before, so I think that's a very good opportunity. So yes, please stay in touch. With regards to, I think it's very difficult if you ask me for a single piece of advice. I would probably just follow what your company logo is. That if you want to if you want to do something, if you want to empower yourself, you have to empower people around you. And we are talking about women. And just if all these, Dr. Jaria and Dr. Farah and Dr. Sana, they were all talking about educating women, information, dissemination, what the knowledge they have. But my piece of advice is, no matter how innovative and no matter how modern technology we introduce in our setting, there's one basic rule for success, and that is you need to make sure that you contextualize it according to the people that you're introducing, according to the environment that you're introducing. For example, I was listening to Dr. Jaria, and she was talking about the laser, and it took almost 10 years, for people in Pakistan to actually know, to get used to it. And it's because what we are doing is we are bringing new things, but we are forgetting about what is the culture, whether people will accept it. So we have to introduce this or contextualized in a way that, whether it is in terms of the language, whether in terms of culture, whether in terms of how they perceive things, in a way that it should be acceptable for them. We cannot bring innovation in a culture from a Western world and we expect people to just accept it as it is. We have to modify it according to how they like to take it. So that's just my piece of advice. Thank you.
Thank you so much. Absolutely, whatever you have said, it is absolutely right. Now, coming towards Dr. Jaria, yes, Professor Dr. Jaria, can you please share with us your piece of advice with us?
Yes. Thank you so much, Dr. Bismeen, for a very nice piece of advice. Yes, you're absolutely right. Contextualizing things is important, but it's I think difficult to actually do that to some of the very latest innovations at the given time. How do you contextualize, for example, AI in our local scenario where जहाँ दम करा लेते हैं लोग, तो it's actually certainly very, very challenging, and of course we do where we can, and sometimes we're really handicapped.
I tell you something, just a very quick comment. So best thing is to get those people who do them on board with you. That's one of the things. The people that they believe, you need to get them on board with you, and then the mass will follow you. So that's just
yeah, but there are 2 or 3 different, we have very, very different mindsets at play here, and then
I know.
some people have vested interest. So things are actually, and this is something I think which has been documented as well, things are actually a little difficult to sort of, and that's why we are where we are, a little lagging behind things. But my take home message for the people interested in healthcare tech, especially the girls, that don't be discouraged. I mean, even if something appears that it's not working, still that would give you an edge over the others. Like, for example, some of my major projects, they failed, like celebrity diagnostics, for example, and then we had introduced a laser-based oral cancer screening device. Interestingly, oral cancer is one of the most common cancers in Pakistan and India and Sri Lanka and Bangladesh. Actually, it's the most common cancer in men, followed by the prostate cancer, and in females, the breast cancer is now becoming more, but it is either at number 1 or number 2, oral cancer. But when I introduced the oral cancer screening device, what I heard I've seen this from educated people saying that this is laser that puts out radiation, and if you're using it to screen cancer, it's actually gonna cause cancer. No matter what you say to them, there's no evidence base and etc. People are still a little biased about these. So this project, I had actually introduced Veloscope back in 2013. And I hardly could use it. It was just sort of a toy that I was using. So don't be discouraged if you meet certain circumstances. 1 or 2 things, if they do not see success, your other endeavors and other technological advancements would definitely be successful. And don't lose heart and keep on trying.
Thank you so much for such a beautiful message, Dr. Jaria. Now coming to Sana. Yes, Sana. From your inspiration story, what do you want to give us a piece of advice?
I think thank you, Humaira, for saying that. But I think from more, it's not an advice, but it's just that I started Her Health with the vision that you can only be empowered if you're healthy.
Yes.
If you're not if you're not healthy and you're not alive, how can you be empowered? So we talk a lot. I've been part of a lot of platforms where we talk about women rights advocacy, equal rights, DEI, empowerment, all these big cliche buzzwords that we use on social media in our talks and our power motivational speeches in different public platforms. I've been a part of a lot of panels who do that, but all I see in Pakistan when it comes to health, especially in the last 6 years that I have been in touch with medicines, doctors, pharmacists, and a lot of people who were suffering just like me and they didn't know how to navigate through the journey. I think the only thing that I would like to say is that if you really want to be empowered on the patient side or on the side where you need a solution, you need to be aware of what your health is, what can you do to improve it in order to be actually empowered in true letter and spirit. And on the other hand, if you want to be entrepreneurial, if you want to try out your luck in health tech, there's a lot of room in Pakistan where health tech can still be taken up, and there's a lot of room for doing something different other than just developing an application where doctors and patients can sign up and book a consultation. So, and also, I would like to add one more thing. A couple of days ago, I was about to sleep, and as long as all the doctors tell us that, please leave your mobile phones at least an hour before you go to bed. But I was just about to sleep and I received a ping on my phone. So I started scrolling on Facebook, and there was a page for science. It had uploaded a video that how prisons and criminal behavior correction in the US is going to be revolutionized by the use of generative AI and machine learning models, in which instead of imprisoning somebody sentencing somebody for 5, 10, 20 years for different crimes, you have to just enclose them in a pod and use a generative AI based and ML based model on their minds, where they will experience that kind of time elongation within their head, while on the actual earth the only time would be 10 or 15 minutes. So I was baffled. It was mind-boggling that how we understand that AI is only limited to generative ability or ChatGPT per se, while the rest of the world is doing wonders with that. And in Pakistan, we're only stuck. The non-doctoral community I'm talking about, we have enough perspective from the doctor side. For the non-doctor community, we only think that as far as the AI would go for diagnostics is that it would make wrong diagnosis, or if it start making correct diagnosis, it will get the doctors out of the job. So this has to be changed, and for that I think people like you who are organizing these kind of interactive sessions, it will play a great role a year down the road, 2 years down the road maybe, just to let them know that what the world is doing, how far behind are we, and what exactly people like us need to do. Come forward, and if we're entrepreneurial, if we want to do something, health tech is something that has a lot of potential. And also a lot of doctors can come forward as founders and CEOs for health tech.
Thank you so much, Sana. As we move forward, let us carry the spirit of this conference with us. Let us continue to empower each other, collaborate, and drive change in the health technology industry. The connection we have made today and the ideas we have shared will spark new opportunities and innovation. Remember, our journey does not end here. The conference is just a stepping stone in our collaborative mission to revolutionize the health technology and make healthcare more accessible, equitable, and effective for all. Thank you once again for your participation and for being a part of this incredible platform. Together, we are empowering SHEalth and shaping a brighter future. Empowering women isn't just the right thing to do, it's the smart thing. As we end the 4th Women Entrepreneur Virtual Conference, let this quote remind us of our incredible potential when collaborating and innovating. Together, we can empower SHEalth and transform the future of technology. Thank you so much. There's a token of appreciation I will be just sharing with you on WhatsApp. Once again, thank you so much, all of you.
Thank you so much.
Thank you,
so
Humaira.
much.
Thank you.
Very nice initiative.
Thanks a lot.
Thank you.
Thank you.
Thank you for having us, Humaira.